the lower income communities already experience worse health outcomes. And the second one is lower capacity to cope with economic and health shocks. Third reason is less access to healthcare. And the fourth one is the pre-existing health conditions. But if we just look at this picture, we will have a wrong idea of what is going on. Because when you see this, you'll say that, well, white people are dying the most. The highest death per 100,000 people are the black people. The next one is the indigenous people. And then we have Latino, then we have Pacific Islanders, then we have some unknown races, then we have white, and the last one is the Asian. So this will give us the complete picture. Only 12% people in the US is black, but their share of death is 21%, which is almost 10 times more than their population share. Then we have Hispanic population. So Hispanics are accounted for 17% of the total population, but they're also having the 21% of share of deaths. For Hispanic population, they were actually doing good in the May till August, and then the death actually rised above 100% of their population share. So why this is the case? If we look at the places where we have the most amount of black population, these are the states where it hit first. So during the May, it hit New York and this region. So that's why we have highest death among black population at the beginning. Now let's compare that to the Hispanic population distribution. So it looks like California, Texas, they were hit later, maybe during August or July. At that time, the death and cases actually peaked for Hispanic population. So in other words, whenever the cases or the virus actually hit a state, the minority population actually had the highest amount of death and cases. So here's another thing we need to remember, that death is a delayed indicator. So that means the case will rise first and the death will follow. So these are some quotes that I found from a paper. So the first one is, while there's no evidence that people of color have genetic or other biological factors that make them more likely to be affected by COVID-19, they are more likely to have underlying health conditions, having certain conditions such as type 2 diabetes. So now we are seeing the effects of having those food deserts, and those are causing those type 2 diabetes, and now they are dying from this disease because they have type 2 diabetes, obesity, heart disease, and so on. So another reason is racial and ethnic minority members might be more likely to live in multi-generational homes, crowded conditions, and densely populated areas such as New York City. This makes a social distancing difficult. Another reason is nearly 25% of employed Hispanic and Black or African American work in the service industry. Compared that with 16% of non-Hispanic white workers. So as we are talking about the essential jobs, that is also true for Black and Hispanic population. They are more likely to do those jobs where they have to travel, they have to go to work physically. So they have came up with 4 different metrics. So in the first metric, we can see that right after March, there is a spike of in-home activities among people who are in the higher income group than the low income group. We also see that a trend, and we already discussed this, the median distance traveled well stayed the same for low income population, but if we compare that with high income population, that actually decreased, which was expected because there was lockdown measures. So this is an interesting graph, device exposure. So that means how many people they have came contact with. Device exposure measures with how many other devices you have been exposed to. 0 on the x-axis, that's when the event occurred. That means that's when there was a mandatory lockdown started. So we're looking at 20 days before and 20 days after the lockdown. And we're also looking at different income groups. Here we're looking at a graph that's telling us about how disproportionately female dominated jobs were impacted due to COVID-19. On the left, this is the case where we do nothing. So we do nothing, and what should be the GDP? So the GDP will go down by 1 trillion by next year, or sorry, 2030, if we do nothing about COVID-19. So on the middle, we have, if we wait to take action, so we will discuss what kind of actions we can take to remove gender disparity. So if we do that, or if we do a late action, then we are expected to have an $8 trillion of GDP more than 2020 by 2030. But here's the good case where if we take the action right now, then we have $13 trillion more GDP by 2030. And also, if we look at the parity of the gender, that will increase for women. So it's now it's 0.61, it will be 0.71, so 10. In most cases, if we take actions now, then we'll have more participation from female if compared that to do nothing scenario. So now if we look at our paper that we have discussed, so this paper actually focuses on researchers only. So we can see that the time they spend per week, that was actually decreased for almost everyone, including male and female both. Surprisingly, the research actually affected most for multiple different cases. Bench researchers who actually need to go to the lab and perform the research, they were affected the most. For example, chemistry,